The American Heart Association has developed a new course called PAIRS, which stands for Pediatric Emergency, Assessment, Recognition, and Stabilization. The new PAIRS course is designed to aid the basic pediatric healthcare provider in developing the knowledge and skills for emergency assessment and treatment of seriously ill children and infants. The emphasis of this course is assessment and recognition for healthcare providers who may or may not routinely provide care for children. This hands-on approach teaches through case discussions and simulations.
So it's a very new approach where instead of trying to describe and having students imagine the type of patient who we are then going to take care of, we give them examples where the student can see for themselves what a child in respiratory distress appears like.
What we were able to do was to incorporate actual patient videos into the course rather than trying to describe what stridor sounds like or what wheezing sounds like in an infant or child.
Topics include recognizing respiratory distress, failure, shock, or cardiac arrest. During this one-day course, participants will learn how to provide appropriate life-saving actions during the initial minutes of response and are given the opportunity to learn, practice, and demonstrate assessment and life-saving skills. The American Heart Association has introduced exciting new learning tools in this course to create a more engaging educational experience and to optimize retention. Video clips of actual critically ill children, along with unique visual cues in the course, create for participants a dynamic training and also strengthen their application of skills in practice after course completion.
Education today, it requires a different approach. It's not enough simply to present sound science. You have to present it in a way that's entertaining. If you don't hold the viewer's interest, they're not going to learn what you want them to learn.
I'm a pediatric intensive care doctor. I take care of kids in pediatric intensive care units. Clearly, the focus of my life is to treat respiratory failure, shock, and cardiac arrest. So this is right where my heart is. It's very clear that by expanding the education, having interventions in an earlier part of time, when patients come to me, the outcomes are superb.
When precious lives are at stake, performance counts and training makes a difference. The PAIRS course is based on the latest research, science, and education for emergency assessment and treatment of seriously ill children and infants.
Despite all of our work with resuscitation programs, children still experience cardiac arrest, and many of those have the potential to be prevented. We hope this course will fill a very unique niche in that it will help the healthcare providers to recognize kids who have the potential to deteriorate, to intervene with those kids, and to prevent them from going into cardiac arrest.
This course tries to help the healthcare provider at a child's side recognize when they need more help and when that child is heading down a pathway that could lead to cardiac arrest. And our whole goal is to prevent that from happening.
Thank you for your continued support of the American Heart Association. Together, we can make a difference and save children's lives. For more information about the PAIRS course or other ECC programs, go to www.americanheart.org/CPR.